Okay, so this is Dr. Arthur Blain, EMF Pendleton. I'm going to sit down because this thing is kind of low. I talk loud anyway. So Dr. Mansell helped me with this. I wrote this lecture as when you Google it and start looking up proper phrases and wording and so on, it's like a professor, looking up something. And I wanted this lecture to be what you do in an exam room with an actual patient. So that's always written. It doesn't matter whether it's English or Spanish. That's always written at a 4th grade level. That's how we talk to people. We always got to be careful in the medical profession about not using big words in Spanish or English or anything else. Learning objectives, understand general Spanish culture, literacy concepts. I pulled up some Spanish culture. Please realize that it's a generalization. It's like saying the United States is one country. It's not. There's so many cultures here. It's incredible. It's like saying China is one country. There's provinces in China who can't speak to each other because they're such different cultures. Same thing in Russia and a lot of places. So these are generalizations that may or may not be specific to Puerto Rico or Mexico or any other country. And then we can, I'd like to have a discussion about it after the lecture too, just so I can learn. Basic medical Spanish vocabulary, and I put some phrases in there. And I structured the whole thing around an actual physical exam. So this is like the order in which we see patients and ask questions and the way the doctor sees the patients. And so you'll kind of see what I'm talking about. So references, there's a teaching from a Hispanic perspective. There's a medical Spanish interview book. You can pull up these references later if you want to see it. There's a website called MedicalSpanish.com, which I found interesting. Let's see. And this is obviously part of this innovative readiness training that we're doing in Puerto Rico with the Navy. We had 4 sites: Cataño, Yabucoa, Humacao, Guaynabo. I actually, you guys saw that I got here late. I actually got an involuntary tour of all 4 sites. It was, Chief Gomez accidentally dropped me off at Humacao and said, "Hey, this is your site," and it wasn't. The way they got me to the other sites is the OIC over there said, the bread truck came around. They got to deliver bread to all the sites. She goes, follow the bread, follow the bread. And so anyway, when I get my command coin one of these days, I'm going to put follow the bread on it. So anyway, so I saw every site, which was interesting. So let's see. There were some, I think my favorite thing here was that black dog. How many of you had your spouse say yes or no on bringing the black dog home? Okay, some of you. Okay, but anyway, yeah, my spouse said bring it home, bring it home. She even sent me a link on how to do it, and I go, no, we're not doing that. It was interesting. A few of us went out to the Air National Guard, and I found that really interesting and kind of a profound experience. They were grounded because their plane went down in Savannah, Georgia. They're not flying at all for like a few months or 18 months or something. They're retraining somewhere. We got to see their mugs on the wall. You saw Dr. Rivera here the first day. He's the only one who didn't get on the plane. And so he's profoundly struck by losing his colleagues. And so I just found that really interesting. I was in flight school quite a few years ago, and so it kind of hits home. So cultural literacy, the very first day I got here, you guys were talking, I found it interesting with the difference between, gringo and Boricua. Anyone from Puerto Rico, anyone from not Puerto Rico. The people here are obviously very appreciative, and it's not a pejorative type of a term. I put in here some interesting things about how parents and guardians are addressed as far as la medición. My wife is Mexican and half Scottish, half Mexican, so I've heard a lot of this, and I didn't really think about it until you mentioned it, and I go, oh, God, you're right. That's how they're always addressing each other, with bendición and que Dios bendiga, may God bless you. So I found that interesting. So cultural literacy. So you have to think about the needs of the group versus the needs of the individual. So Hispanic society, typically the family or group takes precedence over the needs of the individual. And these are generalities. Hispanics tend to be brought up to be cooperative versus the Anglo culture, which encourages more individualism, more competition. Sharing objects and information is encouraged. I taught high school, 2 years of high school. If everybody asked me how I learned to speak Spanish, I taught high school 1 year and junior high school in Spanish. I taught science, and they had a law in California where if most of your kids speak Spanish, you have to teach them in Spanish. And I didn't have a teaching credential, so which I thought was really, really cool because I got to teach for 2 years. High school and junior high school in Spanish with an emergency credential, and they didn't care as long as I went to night school and took a couple classes or whatever. So the first couple of months I was dying, and after that, it's like anything else. You pick it up really fast. One of the biggest. I've had many people, but here also I've had several people say, "Wow, you speak really good Spanish." I've had the Puerto Rican people say that, and my only challenge is I have a little bit of trouble hearing it when they're talking too fast. So I always have to say, habla más despacio, or puede repetir, so I have to repeat things or get it again sometimes, but we communicate. So more about culture, different perspectives about present and future. So present time has more value than the future. Hispanics focus more on present needs and concentration on more short-term goals rather than long-term goals. Fast-moving and closely timed activities are very stressful for some Hispanics. I saw that when I was teaching too. If I try to, I've had people ask me if I'm from New York. I'm from Southern California, but I'm energetic. I talk fast, I guess, sometimes, and that tends to be a little bit stressful in some situations in Hispanic culture. The Hispanics often grow up in a more relaxed home atmosphere where minutes, hours, days are rarely considered to be critical factors. And there's differences. Trust me, I know plenty of doctors and lawyers who grew up in very Hispanic households that are very, hey, you got to get this done quickly or whatever. So these are generalizations. The communication styles, respect is highly valued. It's shown by formal titles. Hispanics tend to show affection through touching, a lot of hugs, a lot of kisses. I would say half my family is Italian, and Hispanic and Italian families are very similar. You can't get out of my house when I was growing up without getting just slobbered and kissed upon and hugged and whatever. And some people don't like that. Some people are, my first wife is Chinese, and she got to my house and everybody's like hugging and kissing and slobbering, and she was very uncomfortable to start with. So Hispanics tend to be very polite, and this is often misinterpreted by Anglos as being subservient or servile. It's not that. It's just being very polite. So there's expressions. So a sus órdenes, at your command. Mi reina, my queen, mi rey, my king. So these are just examples of respect in Hispanic culture. Adapting to the environment versus controlling it. There's often metaphysical powers. The religious, talk that was given tend to, they talk about curadoras, the healing woman. I've had plenty of my patients go to, they put way more, some people put way more trust in a curadora than me. I'm prescribing cholesterol medication, hypertension medication, but I have to respect the fact that they're kind of very partially listening to me, whereas they might listen to these other people more so than me. People call it witchcraft. It's not. I don't think it's not quite the same. So herbs, there's a lot of, you guys are, I don't have to tell you guys that more people go to naturopathic doctors and nurses and curadoras and all kinds of stuff than MDs and DOs, right? So you have to know a little bit about that stuff. That's a whole another lecture. But herbs play a significant role in healing and bringing good luck. The uniqueness of the individual is more important than individual accomplishment. The good of the whole more important than individual goals. So these are some things that we talked about. Children. So I found this kind of interesting. The Hispanics tend to have a very special way that they talk to children and play with children. Small children in church are often seen running up to the altar and sitting down there during a service. They rarely spank children in public. They address children with, if you hear the word usted, it means you, but kind of in a formal sense. If you hear a parent doing that, they're somewhat reprimanding their child. Sometimes they call their children papito or mamita, little papa, little mama, expressions for small children. Older children of family are expected to take care of younger ones. My wife is a good example. She practically raised her two younger brothers. While the other part of the family was working. The child has a strong sense of identity with the family, community, and ethnic group. So that's just a real brief Spanish culture introduction. So on to the medical part of the lecture. Let's see. Somebody time me. I want to cut this off at 45 minutes. How long have we been gone? When did we start, maybe? Okay, 5 minutes. Yeah, I told you I talk fast. Okay, so vocabulary. You guys know a lot of this vocabulary. So, hello, hola, buenos dias, good afternoon. These are just real brief phrases. By the way, you can look this up, by the way. So if you find any part, you'll see how I structured this. If you find any part of your exam or interactions that you need to brush up on, just pull up you can pull it up on your phone. I sent it to you guys. Pull it up and go, I need help with the physical exam, or I need help with the family history, or whatever. And the way I got really good with medical Spanish is like, I don't do it anymore because I know all this stuff right now, but I kept a little medical Spanish book and a little dictionary in my white coat pockets, and I struggle with a few interactions, and then I literally go out in the hallway and go, okay, now I know how to say arm or leg or abdomen or whatever. So good evening, buenos noches, I'm your nurse, soy su enfermero. So you got to know how to say nurse, doctor. I am your doctor, soy su doctor. There's always more than one word to say things in English and Spanish. Medical is, they often use for doctor, doctor, it works. ¿Cómo se llama? What is your name? How are you feeling? ¿Cómo se siente? Sometimes a veces, goodbye. There's various ways. Adios, hasta luego. You'll hear me. I always say, and I don't even know if it's 100% accurate, but I always say tengo buen día. I'll say have a good day, and they know what I'm saying, and I'm probably speaking Spanglish half the time, but it works. And I'm not going to repeat everything on here. I'm just going to go over some things that I think are somewhat useful, and then you guys can look up stuff later. Let's see. I always like to know who people live with. It doesn't matter whether it's medical Spanish or otherwise. I want to know what their social situation is. That tells me what kind of care they need when I send them out the door. It's like, do they live alone, or whatever? So I say, con quién vive? Who do you live with? So I want to know if they have their children, taking care of them, or if they live with their grandmother, or. So are you married? ¿Está casado? Are you divorced? ¿Está divorciado? Widowed? ¿Está viudo? ¿Está separado? Dr. Mansell and I got in a big discussion whether es or está, but you can say está on all these. When you say está, it's more of a temporary are you. When you say es, it's more of a permanent. But either way, people understand what you're saying. So I tried to, Dr. Mansell and I tried to change this into a conversational Spanish lecture, as opposed to strict, grammar on some of this. This is hopefully the way people talk. And by the way, as you're going over this lecture later, send me emails, especially Spanish-speaking people here, send me emails and say, hey, you might want to change this a little bit, or I'll change the slide set later. So what type of work do you do? I always want to know what type of work people do. That has a huge impact on how they, what kind of disease they have and how they deal with their disease. So as you see, when I did this medical lecture, I'm thinking about how I interact with patients in a medical diagnosis treatment standpoint is how I wrote the lecture. That's I think kind of makes the lecture unique. What type of work do you do? ¿Qué tipo de trabajo hace? So what type of work do you do? Where do you work? ¿Dónde trabaja? I like to know where they work. And I asked the same questions here the entire time I was here. A lot of people work in the fields. A lot of people do agriculture. So let's see. There's basics. I'm not going to go over basics. You guys know all the basic stuff, like 1 through 10, 1, 2, 3, 4, etc. But some of the other stuff, get to where you can count to 1,000 if you're gonna at some point, and it gets really easy after 10 or 20 because it's just you just know you have to know the 30, 40, 50 word, and then you just say so 20, 21, 22, 23, and the same thing with 50, 51, 52, etc. And you have to know all this to prescribe medicines, right? To write a prescription. I write and read really well in Spanish, so when I was at UCLA, I took 5 courses. That teaches you to write and read. Doesn't teach you how to speak too well. You got to speak well. You got to jump into a culture and just dive in. That's the only way you're ever going to learn how to speak well. And you have to be in a situation where you can't speak English if you wanted to. Because in other words, you have to be forced to speak it. So 30, 30, 100, 100. Okay, so I'm thinking about, I'm starting to talk about doses of medicines. 1,000, 1,000. So, I'll have these conversations with people. Yo voy a dar usted 1,000 miligramos de, erythromycin. So I'm telling the patient what dose I'm going to give them. I'm telling them how often I'm going to give it to them. You guys probably all know all the days from high school Spanish, like lunes, martes, miércoles, Monday through Friday, Monday through Sunday. Date, la fecha, right? Week, la semana. Mañana is tomorrow. Ayer is yesterday. Anoche, last night. The months, you need just memorize those from your previous classes. January, enero, febrero, marzo, abril, mayo. And I'm not going to repeat all of them. The seasons are sometimes helpful. Spring, primavera, summer, verano, fall, otoño, winter, invierno. So onto the human body. And the way I organize this lecture, and the way I practice, the way all of us practice, the doctors, anybody here, head to toe, right? Like if you see a patient and you start like going, let me look at your ankle, and then wait, let me look at your throat. You're just going to get confused and you're going to miss things, right? Just from a clinical standpoint. So same thing when you go over something like this, you start from head to toe. So head, cabeza, neck, cuello, ojos, so eyes. There's different words for ear. Oreja could be ear. Oído. I use oído a lot. Teeth, dientes. I could have wrote like several slides on dentists here and optometry, but for the people who are the most busy here. Throat, garganta, chest, you can say seno. There's other words for chest. Abdomen is written the same, but you have to get to pronouncing the vowels in Spanish, right? So it's not A-E-I-O-U, it's A-E-I-O-U, right? Y is, so you have to get your pronunciation down. Mine's not perfect by any stance, but people understand me. So waist, cintura, and arm, brazo, armpit, same thing. You can say axilla, forearm, antebrazo. See, a lot of this makes sense from medical. If you just know like the medical prefixes too, it's all Latin based. leg, pierna, hand, mano. I didn't put la or L on these, so that we took the la and L off of all these. So you have to know which ones is masculine, feminine. Back, espalda, buttock, nagas. My kids know a lot of Hispanic words and bad words from playing soccer their whole life. If you guys know, if seen kids on the soccer field. Let's see, hombro, shoulder, cadera is hip. I find the joints really helpful because I'm always pointing at a joint. Knee is rodilla, ankle, tobillo, rectum, recto, or you can say ano for anus, tongue, lengua. Female parts are really important. So uterus, utero, ovario is ovary. So they're similar, right? Let's see. Prostate, prostato, toenail, uñas, nails is uñas. Testiculo, I'm doing testicular exams in males. #1 cancer, ages men through 15 through 35, right? So you should be talking about testicular exams. Nariz is nose, labio, lips. Let's see, more stuff. And then the internal organs I got to. So appendix, you can say appendice. Arteria for arteria, vena. They'll tell you all this stuff, and so vejiga, bladder. So let's see what else. Esophagus, so esophageal, cerebro. I'm going to get into phrases here in a second. Gallbladder, vesicula. I hear that one all the time. Everybody's got gallstones. So they will always tell you about this vesicula. So that's gallstones. If you hear that, probably. If they had mentioned the word vesicula, they got gallstones. So heart, corazón, intestines, riñones, kidneys, liver, hígado, pulmones, lungs, piel, skin, spleen. Some of these I haven't used in the past, and I kind of learned as I was making the lecture. Spleen, bazo, okay? So because you're pointing at different parts of their stomach, right? Estomago for stomach. Let's see, what else? Then I went on to like parts of the, where we worked in one room, but you're going to be in a doctor's office or a hospital at some point. So doctor's office, you can say, I always use the word sala, for a room, but you can say consultorio, or you can say sala de doctor. It works too. Escaleras for stairs, elevator, ascensor. Or you're going to ask them about if they've been into an emergency room, sala de emergencia. Let's see, and pointing out places where we worked. Entrada, entrance, salida, exit. What else? Laboratorio for laboratory, although if you put a V in there, it could mean restroom. There's a difference between Mexican Spanish and Puerto Rican and Spain. I've been in all these countries, and it's very different Spanish. I had a heck of a time ordering food in Rota, Spain, because the Spanish is very, very different. So operating room, sala de operaciones, so operating room, teléfono, telephone. There's a whole bunch of words for toilet. Servicios, excusado. Let's see what else. Okay, and then medicine. So types of medication. So we worked in the pharmacy. We're telling people about types of medicines. Antacids, antiácidos, antibioticos. A lot of this is Latin based, right? The words are almost the same a lot of the times, but you have to pronounce it, using Spanish. So antibiotics, antibioticos, let's see, antihistamines, so antihistaminicos, antiseptico, aspirina. I use these words every single day in my practice. I work in a hospital right now, so I'm constantly giving people aspirin for heart attacks or whatever. There's a whole bunch of words for tablet or capsule or pill. You can say capsule, capsula, pastilla is pill. You can say tableta, I've heard that one. Let's see, diuretic, diuretico, eardrops, so gotas for drops, hormones, hormonas, insulina. And then let's see, and then you're going to tell people what frequency you want to give stuff, or so let's see. Whoops. Okay. There we go. Okay, so I'm going to go on to pain real quick. Pain is, there's maybe half the time people are telling me about some sort of pain. So dolor is pain. You need to describe the pain sometimes. Dol, there's different ways to say dol. First of all, mild, moderate, severe. Leve, moderado, severo, and there's a whole bunch of different ways to say those also. So you could say medium, you could say regular. I get it down to a basic level. I say más o menos, or I'll just say does it bother you a lot? Le molesta mucho. And grande, you can say mucho. I use a lot. Fuerte is strong for strong pain. Sharp, you say agudo or punzante, or it seems the one I always hear patients tell me a lot is pica. Pica is something really poking at them, or sharp. You can say burning, ardor. I always find the wording on these very similar. So it's an English word too, right? Ardor, like for burning or love or whatever. So burning, same thing in Spanish, but burn, when you hear that in Spanish, it usually means burning. Constant, constante, always, siempre. You're asking people if they have this pain. Intermittent, you could say intermitente, but that's kind of a big word. Más o menos, or I say a veces, at times. Location, so in your headache. So dolor de cabeza, and you can add de anything. Dolor de rodilla, dolor de pierna, de garganta, de oído, or dientes, dolor de dientes, back pain, dolor de espalda, chest pain, dolor de pecho, joints and muscles. So I've heard joints in Spanish several different ways. You can say articulaciones, like articulations. Articulaciones, I tend to hear juntos more, juntos, I don't know. There's different ways to say it. Muscles, músculos, dolor de músculos. Let's see. So getting on to some phrases. This is, I think, the most useful part of knowing how to interact with people. So what is your address? There's different ways to say it. You can say cuál es su dirección, donde vive, where do you live. First name is nombre, last name is apellido. A lot of times you ask them what their name is, and they're always just going to say Jose, Maria. They're not going to tell you their full name. You can't say what is your name. You have to say, apellido. Apellido is your last name. So let's see, or you can say here, a good way to say it is nombre completo. What is your complete name? Say cuál es su número de teléfono. What is your cell phone? Social security number, número de seguro social. The words are similar. You just have to put in the Spanish pronunciation. Ciudad, cuál es su ciudad, o estado, state. Zip code, zona postal, email address. I found correo electrónico. And by the way, I need you guys to. I know there's really helpful input that is going to come my way as soon as I stop talking. So I need you guys to give me some input afterwards about better ways to say some of these things. Let's see. Marital status. ¿Cuál es su estado civil? ¿Está casado? Married? Single? Soltero? We talked about this stuff earlier. Are you employed? I originally wrote this saying está empleado, but we changed it to está trabajando. Are you working? What kind of work do you do? ¿En qué trabaja? Who is your employer? Probably the simplest way to say it is ¿quién es su jefe? Jefe's boss. And then they'll tell you I work for Boeing or whatever. Let's see. So, when were you born? So, fecha de nacimiento, birthday, right? Place of birth, donde nació, and what color are your eyes and hair? ¿Qué color son sus ojos? So, you're talking about their eyes, or cabello would be hair. How much do you weigh? ¿Cuál es su peso? So peso is weight, or ¿cuánto mide? Means how tall are you? ¿Cuántos años tiene? How old are you? There's different ways to say how old are you. And let's see. Your blood type. ¿Cuál es su tipo de sangre? You can say that. Insurance. ¿Tiene seguro? Médico. I use that a lot because I work in a hospital. I need to know if they have insurance because that's going to change everything. You guys know this. It doesn't matter whether it's English or Spanish. I really need to know if they have a Blue Cross or if they're going to go down to the community clinic or whatever. And let's see. Driver's license, licencia de manejar. So driving is manejar un coche, to drive a car. So licencia de manejar. If you're asking them for their insurance card, tarjeta de seguro médico. Let's see. And let's see, how are we doing? How are we doing on time? I wish this thing had a clock on it.
You're at 25.
Cool. So I'm only going to talk for 15, 20 more. And then the rest of the exam, I'm going through history and physical exam. So this is, to me, this is the most useful part of it. I Googled everything earlier in the week about different medical Spanish websites and books and this and that. I have no idea why, but nobody organized it into a history and a physical exam, which is, so what we do for a living. We do a history and a physical exam. So I just organized it that way. And that's the way all clinicians and anybody who works in the, that's the way we think. So, so chief complaint. The first thing you do is ask a chief complaint. ¿Cómo se siente? How do you feel? And I asked this, I don't know how many, I asked this every single visit in the last 2 weeks. What is the reason for your visit? La razón de la visita. Or I just simplify it sometimes. ¿Por qué está aquí? Why are you here? What brings you in? And most of the time, I need eyeglasses. But there's still a lot of times they needed, real stuff, like the big rash on the arm, or the guy who came over with a big thumb abscess. And you guys know, and I'll throw some advice in here too. Chief complaint probably should be in quotes, right? Chief complaint is not why you think they're here, or it's what they told you. So it kind of should be in quotes. History of present illness. And you can see my slide later. I even put some coding in here for you guys. You can't put a little tiny history of present illness. You can't say, 32-year-old here for abdominal pain. Physical exam is next. Number one, it's not a good history, which is where you're going to get your diagnosis from. Number two, you're not getting paid for the visit. You got to put some more details in. So PQRST, right? So when you ask them about pain, so onset, when did your pain begin? ¿Cuándo empezaron los síntomas? Síntomas o dolor. Síntomas is symptoms. Provocation, palliation by PQRST, right? We always go through. What makes your pain better or worse? ¿Qué lo hace mejor o peor? So mejor is better, peor is worse. Describe your pain. Describe el dolor. And radiation, so ¿dónde es el síntoma dolor o de radiación? These are just different ways you can ask where is the pain or is there radiation. Severity, I find this useful. So what is your pain on a scale of 0 to 10? ¿Cómo es su dolor en una escala, scale, right? Escala de 0 a 10. When did it begin? When did it end or change? ¿Cuándo empieza? Like, when did it begin? ¿Cuándo termina? When did it stop? Alleviating factors. What makes your pain symptom better? ¿Qué hace su síntoma mejor o peor? Let's see, associated symptoms. ¿Qué otros síntomas tiene? So what other symptoms do you have? Let's see, past medical history, past surgical history, right? So, I'm kind of going down the list of how you're going to ask the questions. So, past medical history, ¿qué problemas médicos tiene? What types of medical problems do you have? I always want to know if somebody has visited the emergency room. So I say, ¿ha visitado la sala de emergencia? Have you visited the emergency room? Have you visited the hospital in the past? ¿Ha visitado el hospital por algún razón reciente? Have you visited the hospital for any reason in the past? And then I ask specific diseases about past medical history. Do you have any history of heart disease, diabetes, high blood pressure, cholesterol, etc.? ¿Tiene un historial de enfermedades del corazón, de heart? Diabetes is diabetes. Alta presión, you can say alta presión. There's a whole bunch of different ways to say high blood pressure. Alta presión, you can say hipertensión, but I think that's getting the words a little higher. Cholesterol alto, ataque cerebral, so attack of your brain, basically that's what it says. Ataque del corazón, heart attack. I've heard patients use what I thought were kind of big words to me, like they'll say infarto. That means it's infarct, right? Myocardial infarction. So they'll use the word for you. Past surgical history. Have you had any surgeries in the past? ¿Ha tenido cirugías en el pasado? So surgery is cirugía, and then you can ask different types of surgeries. You could just make it simple and point to different parts of the body, but kind of know the words for those parts if you can. ¿Cuándo fue la cirugía? When was the surgery? Let's see. They'll tell you that you can say operaron, operate. So they operated on my knee or my hip or uterus. So me operaron el rodilla, útero. So they'll tell you different parts of the body. Family history, just going down the list that we normally interact with people. So do you have any family history of diabetes? ¿Tiene historial en su familia de diabetes? So do you have any family history of diabetes? Enfermedad del corazón? And so do you have any history of heart disease? And I always ask, you'll see the way doctors ask, we only really care about first degree relatives. So mom, dad, brother, sister, because there's really not a big risk of disease unless it's in second degree or third degree relatives. So en su mamá, papá, hermanos, hermanas. So social history, I don't know about most doctors, I only care about smoking, drugs, alcohol. So do you smoke or do drugs or alcohol? Usted fume, so fumar is smoke. Usa droga o alcohol. How many packs do you smoke every day? So ¿cuántos paquetes de cigarrillos fuma al día? So you're asking how much they smoke. When did you quit smoking? ¿Cuándo dejó de fumar? So when did you quit smoking? ¿Qué tipos de drogas? What types of drugs do you do? So allergies, medications. Alergia is allergy. So tiene una alergia a penicillina o sulfa. So I'll just ask the question about penicillin or sulfa. What is your reaction to the medication? ¿Cómo fue su reacción a esta medicina? So it matters to me if they had a little tiny rash, a red part on their arm versus lip swelling versus, something more dangerous. So I'll say, ¿cómo fue su reacción a esta medicina? Dificultad de respirar, so difficulty breathing. There's a whole bunch of words for rash in Spanish. You can say salpullido, I've heard broncha, I've heard área rojo. There's like 20 words for rash, and which I'm learning slowly. Labios hinchados, hinchar is swelling, so swollen lips. I want to know if they have swollen, if that was part of their reaction to taking penicillin. Medications, medicinas, or medicamentos. So what types of medications do you take? ¿Qué tipos de medicinas toma? So tomar is take. So what types of medicines do you take? Let's see. What I care about more, if you guys listen to me this week, I want to know if they're actually taking it. They got a list of medications. Like, are you fine? The guy. I've heard a whole bunch of people this week saying, yeah, I take my blood pressure medicine about once a week. Yeah, that's great. And then I have to explain to them that, okay, this is how you're supposed to do it. And I'm guessing the curadora tells them to take it only when they feel like their blood pressure is high or something. But usted toma sus medicinas diariamente. Do you take your medications every day? And I've had, I'd say half my patients this week said, a veces, cuando siento malo, or something, Do you forget to take your medicines? Olvida tomar sus medicinas diario. Do you forget to take your medicines? Olvidar, olvida is forget. I want a list. Nobody has a list of medications, but I always ask, I say, ¿puede darme una lista de los nombres y los dosis de todas sus medicinas? Can you give me a list of the medications and the doses? And, I got them once or twice, but not much. So review of systems. For those of you who are nurses or medics, if you guys are medics, you are the doctor out in the field, period, end of sentence. You're it. Take a review of systems. I didn't used to do this the first few months after graduating medical school. This will help you with diagnosis. This will keep lawyers away. So somebody comes, I'm throwing in a little clinical part here. So somebody comes in for wrist pain, right? And you didn't go through a brief review of systems, and then they go to the next doctor the following day. He goes, yeah, man, I had chest pain yesterday with Dr. Blain, but he never asked me about chest pain. And then they have a heart attack. You're in trouble because you didn't ask them. So go through review of systems before you go to your physical exam. So general, I only asked 2 questions on here. I can go through a complete review of systems in 2 minutes, in Spanish also. And I tell my residents, I teach in a residency program, so I tell my residents the same thing. So I ask 2 questions, and then people start responding positive, then I expand it, right? So general, so you go, fevers, weight loss, fiebres, pérdida de peso. Those are cancer questions, right? Is what I'm thinking in my brain. Like if they go, yeah, I have these unexplained fevers, or I lost 30 pounds in the last 2 months, then my review assessment goes, real big. HEENT, headaches, vision changes, and this is my review systems that I do. I do it 20 times a day. Dolores de cabeza. Dolores de cabeza. I can actually, you know what? Okay, so recording again. Cardiovascular, chest pain, dolor de pecho, palpitaciones. There's different ways to say palpitations or, I always asked it, I say, siente que va muy rápido su corazón, because sometimes people don't know the word palpitations or sometimes, but I'll say, do you feel like your heart's going fast? You'll hear me beat around the bush in Spanish all the time, and people absolutely understand what I'm saying. Shortness of breath, dificultad de respirar, so difficulty of breathing. Cough is tos, T-O-S. Nausea, vomiting, diarrhea. Nausea, vomito, diarrhea. Sounds the same, right? In Spanish, you just got to get the Spanish pronunciation. Blood in the stool, black stools, excremento con sangre, excremento negro. Genitourinary, pain on urination, blood in the urine. Dolor al orinar o sangre en su orina, so blood in your urine. Bruises or bleeding, cicatrices o hematomas. And there's a whole bunch of words for bruises or bleeding or rashes, but that's one way to do it. Rashes or itching, sapullido or áreas rojos en su piel. Comezón is itching. Endocrine, I always want to know if there's polyuria, polydipsia, polyphagia. In other words, I want to know if you have diabetes. If you answer yes on those, you have diabetes, and I'm going to go stick your finger. Polyuria, do you urinate a lot? Orina mucho. Get it real simple. Just make it real simple. Orina mucho. Do you urinate a lot? Tiene mucho sed. Sed is thirst, so do you have a lot of thirst? Tiene mucho hambre. Are you hungry all the time, or are you hungry? And then I'll ask if they're sensitive to cold or frío. ¿Está muy sensitivo a caliente o frío? Are you sensitive to heat or cold? Joint pains, muscle aches, musculoskeletal. Dolores en sus articulaciones o músculos. Psychiatry. Do you have depression or anxiety? ¿Tiene depresión o ansiedad? The words are the same. You just got to put the pronunciation in there. And then it's super, super important. I don't do it all the time. But the slightest little hint I get, I always ask the question, are you having thoughts about hurting yourself or hurting other people? And by the way, don't just ask people that in English or Spanish. Warn them that you're going to say, listen, I have to ask you a safety, this is what I do, it works every time. I'm going to ask you a safety question, and it's not because I think anything bad's going on, but I ask everybody this question. That's the way I say it, and then nobody ever gets like, oh my God, you just asked me. No, but pensamientos de lastimar usted o otra persona. You're having ideas about hurting yourself or other people. Neurological, loss of consciousness, strokes, seizures, pérdida de conciencia, or ataques de cerebro, or you can say epilepsia, but I think that's getting the words a little higher. There's different ways to say seizures in Spanish too. There's about 5 ways to say that. So phrases, this is the very last part I'm going to go through. Actually, no, sorry, physical exam and then phrases real quick. How am I doing on timing? Okay, 10 minutes and we're done. So physical exam, a lot of this we went through already. So general, I tell people what I'm going to do. So before you go sticking a stethoscope on them or touching them or poking them, you tell them what you're going to do. So that's basically how I structured this. So general, I tell people I'm going to do a physical exam. Yo voy a hacerle un examen físico. Okay, so I'm going to do a physical exam, and then I went on to HEENT. So this is structured exactly like you would go through a physical exam. I'm going to feel your head. Yo voy a examinar su cabeza. I always ask people to look at my nose, so I can look in their eyes. Right? This is how you do your exam. I say mire a mi nariz, and half the time people are like, I say no, mira aquí. Look at my nose. I'm going to use my light to look in your eyes or nose. Yo voy a usar una luz that I have in my pocket para mirar a sus ojos. And you can redirect people. Look here, mire aquí. I'm going to look in your nose. Yo voy a mirar a su nariz. Open your mouth. Abre su boca. I'm going to look in your ears. Yo voy a examinar los oídos. Right? I'm going to look in your ears. Please turn your head. There's a whole bunch of ways to say turn your head, but por favor, gire la cabeza. So turn your head. You can say voltea, vuelve. There's different ways you can sneak it in. I'm going to tap your cheeks, for sinuses. Yo voy a dar golpecitos, like small. It means small hits. Yo voy a dar golpecitos a las mejillas, so sinuses. I'm going to feel your neck. Yo voy a palpar su cuello y su thyroid. So going on to respiratory, I'm going to listen to your lungs. Breathe deeply. Yo voy a escuchar sus pulmones. I'm going to listen to your lungs. Respire profundo. I say that 10 times a day, in my hospital. So respire profundo. You're telling him to take a deep breath, or otherwise you can't hear anything. I'm going to listen to your heart. Yo voy a escuchar su corazón. So genitourinary. You don't do this with everybody, but sometimes you need to do a rectal exam. Necesito hacer un examen de su recto. And I'll put up more details in there because people start getting nervous when you talk about your finger up the rear. So I go into tell them, okay, it's not going to hurt. This is really important, whatever. So I expand that one a lot. I'm going to touch your skin. Yo voy a tocar su piel. I'm going to touch your skin in esta área. Dígame si le duele. Tell me if it hurts. Extremities, you're going to poke on their leg to see if they have swelling. So, yo voy a tocar su pierna para mirar así está hinchada. So if they're swelling, yo voy a sentir sus pulsos en sus pies. I'm going to feel your pulses in your feet. Psychiatry, I'm not going to go over in physical exam because you already asked the questions in the review of systems. You're going to document it on your physical exam, and that's one thing I'm going to throw on here, and is documentation. But that's a later lecture. Everybody always asks me, Doc, especially corpsman and medics, like, how do I document? And that's something I'm going to put on here later. What is your name? ¿Cómo se llama? Neurological. So these are neurological questions. Alert to orient. So you're going to document alert and awake and oriented times 4, right? But you need to ask the questions. So, ¿cómo se llama? What is your name? What year is it? ¿Qué año es esto? What year is it? ¿Quién está el presidente? Who's the president? And usually, everybody gets that question right now for some reason. But let's see, where are you? ¿Dónde está usted? You can ask more questions about orientation. So I went on to laboratory and radiology. I'm going to skip those sections in here, and I'm going to go on to phrases toward the end. But there's sections on here about laboratory, and I ask these questions to patients this week all the time. I said, ¿Cuándo fue la última vez que tuve una prueba de sangre? When's the last time you had a blood test? And there's different ways to say blood test too. Let's see, pregnancy test, examen de embarazo. Okay, so you got to be careful of drunk and pregnant. If you speak Spanish, you know what I'm talking about. Embarazada y emborrachada, right? You can say like drunk alcohol, emborrachada. In Mexico, I don't know about Puerto Rico. Yeah, they sound the same, so you got to be careful. You know how you're pronouncing it. Don't ask pregnant people if they're drunk with alcohol. You'll if you look it up, the words are very similar. Have you had an X-ray? Le han hecho rayos X en el pasado. CT scan is tomografía. Ultrasonido is ultrasound. So different specialists. You have to know the name of different specialists. So cardiologist, cardiologist. Dentista is dentist. Let's see what else. What are some other useful ones? Gastroenterologist. I kind of think these words are getting bigger and people don't really know what you're talking about. They do sometimes, but if I see people with a look on their face like they didn't catch what I'm saying, like if I say gastroenterologo, see, my pronunciation is not great. Some of these words I can't even pronounce. I'll say doctor para su estómago. So just get the words down lower. Say stomach doctor. Internista, what else? Nutricionista. They say ophthalmologist here. You can say ophthalmologo, yeah. But I just say doctor para sus ojos. Pediatra for pediatrician. And then so diagnoses, you have to know some of the diagnoses. Asthma. Arthritis is the same, arthritis. Back pain, dolor de espalda. Cancer is the same, but just pronounce it cáncer. Depresión. Cholesterol alto. There's some spelling things on here I got to fix later. Infección is the same. Enfermedad de corazón, we talked about. And then just briefly, some of the phrases here, and I'm only going to talk 5 more minutes, and then the rest of it, you guys can look over. So let's see. So recommending vaccines. Yo recomiendo vacunas de tétano, influenza, pneumovax, varicella. So you're recommending vaccines to people. What else? And then there's Spanish dialogues. What I put, this is mostly for your reference, so you can go back and pull this up. So, the nurse told you that you're going in a room where somebody speaks only Spanish. So you either grab a nurse who speaks Spanish, or you can just pull up the PowerPoint here and go, okay, I know they have abdominal pain, and just go click, and I put a whole bunch of phrases in there for you for specific diagnoses. And I'm definitely not going to go over all these. Let me go over a couple common ones. Number 1 diagnosis for primary care doctors in the United States is back pain. So let me go over that one. Dolor de espalda, so back pain. Do you perform repetitive movements at work or home? Hace movimientos repetitivos en el trabajo o en la casa. And let's see, I always want to know and I say this different sometimes. I simplify my language quite a bit, but does the pain travel down your buttock or your leg? El dolor le baja a la naga o por la pierna. I'll just say, el dolor mueve a su pierna o a su pie. I'll just say, does the pain move to your leg or something? And what else? Does a certain movement make it worse? ¿Hay algún movimiento que empeore el dolor? Are you taking medication for this? ¿Toma alguna medicina para el dolor? Are you taking a medication for this? What else? I think I'll do a couple dangerous diagnoses, and then we'll call it quits. Chest pain, dolor de pecho. I always want to know exactly where it hurts. You'll see, and I actually lectured on this for my abdominal pain lecture this week. Chest pain, abdominal pain, and various types of pain that can be like all over the place and you're not quite sure where it is, works great. Do this in the field too. Say, I grab their finger, the tip of their finger, and I say, muéstrame exactamente donde le duele con su dedo. So in other words, I have them take the tip of their finger and point where the pain is. So if they point to the left side of their chest, and they tell me it's heart disease, it's not, because your heart's not on your left. It's, your heart's in the middle, right? So it gives me a real good clue. But if you don't do that, then they just go, it hurts right here, and it doesn't help me. Let's see, what does the pain feel like? Pressure, so ¿qué clase de dolor siente? Presión. Then you got to know a whole bunch of words that we talked about before, like what type of pressure, pain, pinching, or whatever. How long have you had the pain? ¿Cuánto rato hace que tiene dolor? And I have a whole bunch of ways that I can say that. And I don't necessarily use some of these phrases. I'll use different types of phrases that are Spanglish that work. Let's see. What were you doing when the pain started? ¿Qué estaba haciendo cuando le empezó el dolor? One thing that's not on this lecture, by the way, which I'm going to fix eventually, there's no accent marks on all the letters and words. I couldn't figure out, if somebody knows how to do that later, tell me. But on Microsoft Word or whatever. Let's see, I think we're just about done. Let me see if there's any really helpful phrases here. Headache's real common. Please point to where your head hurts. Por favor, indique donde le duele la cabeza. Tell me where your head hurts, right? If they're pointing to the back of their neck, it's tension headache or arthritis. If they're pointing to the front of their, up in here, then it's, it's the sinuses. So I really, really want to know exactly where it hurts. Let's see, do you wake up with a headache? Se despierta con el dolor de cabeza. How long have you had the headache? ¿Cuánto tiempo hace que tiene este dolor de cabeza? So how long have you had the headache? Changes in your vision. Cambio en la vista o cambio, I'll just say, can you see well? ¿Puede mirar bien o no? Can you see well or no? And then there's the other categories on here which you guys can review later, just based upon when you're going into a room, I think. Knee pain, neck pain, eye pain, shortness of breath, shoulder pain, sore throat. Sore throat's common, right? Let's see. Upper respiratory infection, colds, I put that on there. UTIs, I put that on there. There's the guy that was sitting around the tables. I stole a bunch of stuff off that. Somebody, that's like $6.95 or something. Somebody had it. That was cool. It's called quickstudy.com. It's another reference. And that's about it. So we talked about cultural literacy, vocabulary, phrases, history and physical exam, medical Spanish dialogues, and that's all I got. And thank you.